I do, and I shorten it. Thank you, everybody, for your patience. Much appreciated. I'm calling the meeting to order because we do have a quorum. And the first thing is for the approval of the agenda. Everyone should have gotten this. So can somebody please move to approve the agenda for today?
I will move it.
I'll second.
Okay, Robert and, sorry,
Linda.
Linda. Yes, senior moment. Thank you. The next thing,
No, we gotta do roll call.
well, first I have to read the script, and the script includes.
Yeah, but
the roll call.
we can't take a motion to approve an agenda and then not do the roll call on the agenda.
Well, the script includes the roll call, so.
Well, not for a motion, so I'm gonna retract your first.
Okay.
All right, so
Just approve the.
We have no
agenda
motion.
After the spiel.
Okay,
We
we're
have no
gonna
mo-
start with my reading
motion.
of the script. As a preliminary matter, I'm Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So please say yes when I call your name. Abby,
Here.
Rocky,
Here.
Robert,
Here.
Aaron is not here, Arlene,
Here.
Jude,
Here.
Linda,
here,
and Mary Ann. Thank you. Staff, when I call your name, please respond in the affirmative. Jericho,
In attendance.
Laura,
Here.
thank you. And we do have a speaker today, Jessica Trimble, and welcome, Jessica. It's so nice to have you today. You know you're here.
Thank you.
This open meeting of the Council on Aging is being conducted remotely pursuant to Chapter 2 of the Acts of 2023. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment.
Will. Trimble,
Because we have a guest, that's public comment.
Yeah.
That counts,
Yeah.
okay. This meeting will feature public comments. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials have been provided. Members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda. And I think that's it.
can you do me a favor and print out the agenda?
So,
Sure.
Extra
let's go
copies.
back
Plenty
to
of them.
approval of the agenda, since that is required.
I'll move it.
I'll second.
Second, Linda. And I have to go down person by person to get you to approve the agenda. Abby,
Approving the agenda, please.
Rocky, yes or no?
Yes.
Robert,
Yes.
Arlene,
Yes.
Jude,
Yes.
Linda,
Yes,
Mary Ann, thank you. Now we're going back to the previous two meetings. We have minutes to approve of both the November and the December meetings, all of which you should have received before now. So let's start with the November 1st meeting. Does someone want to approve the minutes as received?
I'll do it.
Robert, a second?
the only reason, I'll hang on for a second. I was in Laura's office for one of them. I don't remember if that was the
That
November
was
one or the
the-
December one.
No, that was the December one. You were.
I was sitting in her office.
Yeah, that was
That should have been December.
December 6th. That would have been that December 6th. yeah.
Okay, I'm gonna abstain from November because I wasn't here for November.
I'll second the
Thank
motion.
you, Abby, second. Okay, we're gonna again go down the whole list for everyone to approve, unless, let me also say, does anyone have any comments before we do the approval? Changes? Okay, so I'm gonna ask for approval, just say yes or no. Abby,
Yes.
Rocky,
Yes.
Robert,
Yes.
Arlene,
Yes.
Jude,
Yes.
Linda's abstaining, and Mary Ann, yes. Okay, we'll move on to the December minutes, which you received yesterday, I think, or maybe this morning, first thing.
I believe this morning.
I will make a motion
So,
to approve
Okay.
December.
I'll second.
Linda, a motion to approve and Robert second. Does anyone have any comments, changes, etc.? Okay, again, I'll ask for your approval, yes or no. Abby,
I approve.
Rocky,
Yes.
Robert,
Yes.
Arlene,
Yep.
Jude,
Yes.
Linda,
Yes,
Mary Ann, yes. Okay, thank you. And great job with those minutes, I have to say, Arlene. They're so thorough and I appreciate that.
Thank
Now, we're moving on to the official part of this meeting, beginning with the speaker that we have today. Sorry to say that Erin is not able to make this meeting, but her second in command, Jessica Trimble, is here. And she knows everything about tucked in care. And I thought it would be a good idea for all the members of this body to also know about the services provided. So I want to welcome you, Jessica, and I'm going to give the floor to you and appreciate all the information.
Great. Thank you so much. Can everybody hear me okay?
Yes.
Excellent. So again, apologies that Erin couldn't be here with childcare duties that changed. But I just wanted to share with everyone a little bit about Tucked In Elder Care and what we do. And I'm going to sort of start at the very beginning in terms of when Erin sort of gave birth to Tucked In. So she and I are both Washashores. I think she got here in 2015 and I in 2016, so about 5 minutes ago. I had worked, oh, sorry. I had worked at,
I just didn't know what her last name was.
oh, Trimble, sorry.
No, not your.
Oh, Erin, she's Lynch now. She started at Kopecky. So Erin came here to Nantucket and was working at the nursing home and discovered that there was this need for sort of organizing care, managing needs prior to people coming in and when they go home. She'd been working with a company called Best of Care, which is a home health company, family owned, about 45 years old now, based out of Quincy, that provides personal care service, home health aides throughout Massachusetts. And she approached the CEO of that company to say, I want to start a care management wing. And she wanted to start it here on Nantucket. And in exchange, she said she would also start a Best of Care office, a home health care office here on Nantucket. So that started in about 2018 and has grown quite a bit since then. So we do, through Best of Care, we do personal care, home health care, chore work. We have live-in aides as well. One of the things that sets us apart is both that our supervising staff is here on island. I'm a nurse, and so I do nurse supervisions, and we've got another full-time and part-time nurse working here on Nantucket. And our aides are able to drive, which seems to be something that not all aides can do. So they're able to help with transportation either in their own vehicle or driving a client's vehicle. The care management wing, which is what Erin started, is sort of a higher and advanced level of care. And this includes things like medication management, advocacy at doctor's appointments.
Sorry, Jessica, could you repeat the name of that extension you just named?
Sure. So Tucked In Elder Care is the care management component.
Right. Yep.
And then Best of Care.
Best of Care. Okay.
Yeah, that's the home healthcare company. And I'll tell you, I have some brochures about all the companies. I'm happy to share that. I don't know if that was sent earlier, but Mary Ann, I can send that to you if that's something that's useful for everyone. And that also sets up a list of what the services are, both for personal care and for care management. We assist with transportation, we assist with moves, we assist with individuals who live here with families that are far away, where there's a desire for some assistance there. And the key for us is that the individual who's in need of the service, the older adult, is basically the decision maker. So we may have families that reach out to us and say, well, we want help with dad because dad won't listen to us and he needs to move to the nursing home. And we'll meet with dad, and if dad says, nope, I don't want to go to the nursing home, our goal is just to help him meet his needs as long as they're safe. So that's another big piece of what we do. Sorry.
No, people who are not talking need to mute. Judith,
I wasn't sure if she had a question.
There's some down
someone else needs to mute.
Just the gremlin day today.
It is, it's the gremlin.
Judith, do you want to try typing it in chat and I'll read it out for you?
We have muted her.
What's weird is that I see Judith Green talking, but she has her mute microphone on next to her name.
Because we muted it from in here.
Oh.
Yeah,
All right.
it still should be muted. I guess Zoom is just having a day today.
All right, keep going.
I'll sally forth, but I'll stop if needed. So about 2 years ago, our offices moved into Sherburne Commons at the same time that Sherburne Commons went from being an assisted living residence to independent living with assistance at, and we're sort of their preferred provider, but people are welcome at Sherburne to use any provider for their care. And through working with Sherburne, we've started doing more education and community outreach. So we work with Sherburne on some lunch and learns. We've been doing some activities at Sherburne that are for older adults throughout the community. We had Wade Parker, the artist, come and do a paint day instead of a paint night at Sherburne. We also work with VNA, providing our home health aides to help support when there's need for care there and they don't have the staff. Similarly, with elder services, we're able to use our aides for that. And that helps when individuals are able to get some help with elder services, but want to supplement that and want the same home health aide. We're able to coordinate that. We've got a relatively deep bench at this point of home health aides, although certainly that staff is shared with all the other providers here on the island, but we've got about 50 home health aides on our roster right now. So we do have some flexibility in being able to find the right fit, et cetera, and it helps us with scheduling, although that is always a challenge. And we are looking at in the future, some of the things we're hoping to do. We certainly participated in the elder fair at the hospital, but I know that that's something that we're hoping will sort of reconvene into something more elder specific in the future. And we're looking at providing a support group, a monthly support group for caregivers. That's something we're hoping to start in the first half of this year for individuals who are providing care, either professionals or family members, and something where they're able to also bring the person they care for when they attend that support group, which we'll also offer remotely. We also have partners. Basically, Best of Care is our parent company, and under Best of Care, we also have a company called Moving Mentors, which provides assistance with moves, both the nitty-gritty and the packing and the moving, but also sort of the emotional burden, especially for somebody if maybe they've been in a house for 50, 60 years and all the memories in their life that's there and dealing with that. And then there is a free service, Assisted Living Locators, where individuals can get help with looking at different housing options, assisted living, independent living, memory care, nursing homes, and that's free for the client. And they can help with touring those locations and help navigate that process. So I just said a lot of words. That's a little bit about what we do. Any questions at all?
Yeah,
I imagine
questions.
there might be some.
I got questions.
Linda, go ahead.
I'm just typing them to myself, so I don't forget them. So Sherburne Commons is now, contrary to where we started it, all independent living. So if you go from the nursing, from there to the nursing home, there's no assisted living, which was that the congregate building was supposed to be. I got to readdress that at the planning board because I was on, my name's on the plaque in that front hall as a member of the board.
At Sherburne.
Yeah. And I was kicked off because I told them they were going to go bankrupt, et cetera, et cetera. Two of us were. But I designed the building, et cetera, et cetera. So I'm not happy. But what I'm really concerned about is that you're providing basically assisted living care to some of the people over there, and I know some of the people in the
She's
houses.
not Sherburne Commons.
I know, but she's in there and she would be providing that service outside of the Sherburne Commons hierarchy. Because I know some people in the cottages that are getting this supplemental care.
Yeah.
Because they don't have assisted living.
Yeah.
Now, my question for you, they have the Alzheimer's, basically a daycare center in there now. Are you working at all with those people?
Memory Cafe?
Memory Cafe.
Oh,
were-
no, I know that the
there?
Memory Cafe is being hosted at Sherburne. We haven't
Yeah.
been involved with that as of yet. I mean, we're happy to assist, but that wasn't something that we organized.
But there are caregivers involved with the Alzheimer's patients that are in the Memory Cafe.
Yeah.
And those
that's-
people need to be reached out to if you're gonna start a caregivers.
So one of the roles of the Memory Cafe was to do caregiver respite for,
Yes.
as part of that process. And actually, I was gonna, hop on the end of this and see if there was someone we could connect you with the community school, which is administering that, either as supplemental or enhanced outreach. It's good ear.
So that was one thing. My second thing is, does Medicare cover your services?
So Medicare can cover home health care services if you meet certain requirements, which include the doctor basically saying that you are, in essence, a shut-in and not able to leave the house. So for your average person living at Sherburne who goes out and does things and maybe just needs help with a shower or help with chores, it's not covered by Medicare. We can take long-term care insurance, but we aren't able to take Medicare unless those requirements are met.
This is very concerning to me. I think it's, what you're doing is great. But it's
Sure,
not the needs of Nantucketers at all. That are in that netherworld between between the island home and independent living. And that's why, so, and I know it's not your fault, but I was hoping that you would be picking up some of the things that assisted living would have provided to these people that were in there already. In the
So-
assisted living section.
yeah, no, I think it's
For
really
them to pay
valid.
for it, and are required under the law and under the planning board to have several affordable units. And those people can't afford
That personal care.
your
as well.
assisted living support. So
Yes.
I've got a big problem with this whole thing, just in
Yeah.
general. I think it's something we need to talk about at some point as a group, because there's no advocacy for that missing
It's not a
link.
problem for Jessica to solve.
No, But I just
But-
wanted to know who's paying for your services if you're going to be helping
Sure.
bridge that
So-
gap.
I do want to address that. You're right, not my problem to solve, and I don't want to speak outside of what I know, but I will tell you that one of the places where we've been able to still provide service to individuals who may be low income and who may not be able to afford that private care is by working with Elder Services of Cape Cod and the islands. So we do have clients where we're able to provide all the service that we provide is through Elder Services, is covered by Elder Services. They give us a certain number of hours that are approved, and then we use our home health aides to provide that care. And those individuals don't see a bill, but they may want quite a bit more or need quite a bit more service than Elder Services has been able to approve. And that part's sort of beyond my purview.
Yeah, and that would be a problem if we want to keep people in their homes. So you
Correct.
provide supportive services. But sometimes they can't afford it. They don't qualify really for island home. They can't get into an assisted living on Nantucket, and off they go. So I think this whole system, I'm glad you're filling some of the gap,
Yeah,
but it's not enough.
yeah.
Given
I
the
will-
population of Nantucket is, the baby boomers were all over 60.
Yeah,
And we-
no, there's
yeah.
gonna be
So
more and
this
more
is
of
a
this.
problem that the Council on Aging should address
Yeah.
at some point. And from everything I read, it's building to a crisis situation across the whole country. It's
Yeah.
not just Nantucket.
It is.
So can I just put that down for a future meeting for us to discuss?
Yeah, I appreciate what you're doing. I was just hoping that more of it would be covered financially for people.
And
Yeah.
I'd like to ask you, Jessica, how many total clients do you have?
So it's always sort of moving around, but between
sure.
our home care and our care management clients, right now we've got about, I'd say 65 clients we're serving. Some of them are just calling us as needed, some of them with scheduled care.
And I know you're working with some of the people that are in the houses, at Sherman Commons, because I know
Yes,
that care.
Yeah,
they
so
can-
we work with people in the cottages and the apartments, and then we work with other individuals in the wider community of Nantucket. And then we also serve people off island as well, but that's sort of outside of this conversation.
But I
I
like
will
that you're working, there's a medical component, and driving component, which really wasn't available here at all.
Yeah,
To
well, and
hire private nursing care.
I will say, so that's what we don't do currently is we don't do skilled nursing. So right now, our only option is still VNA, but that's actually something else we're working on to be able to provide not the full gamut, but at least things like blood sugar checks, PTINRs. VNA has told us they'd be happy to have us help with that. So that's
Mhm.
something we're working on internally so we can provide more. I mean, our goal, Aaron and I both would like to die here on Nantucket many decades from now. And for me, at least, I have no spouse or children. I want to make sure whatever resources are needed that I'll need when I get older, I want them here and available and not just for people with endless wealth. So I know there's not an easy answer to this, but I do want to say that whatever the council, whatever movement the Council on Aging is able to get in terms of helping serve those people who are not high income, we are happy and interested in finding ways to partner. And we are lucky enough to be part of a big enough of a company. It's really never been about a bottom line of make that money. It's really been about where can we find ways to provide service.
I have one more question. The
Let me
island
just
home?
say if does anybody else have any questions for Jessica or comments that you'd like to make so far? Okay, Linda, go ahead.
I know, at least back in New Jersey, that some people pay for your services, to come into the nursing homes. Do you have any clients at Island Home?
We do. We have a couple of clients at Island Home right now. What we tend to find is that families and the individual after they move to Island Home, because it's private pay again, say, all right, well, we got what we need here. So we're certainly available for them when and if they want, but often when people move to the nursing home, unless it's a short-term or respite stay, that's generally when they say, okay, thanks for your help. And then
You do
sometimes we'll get
care?
involved. Sorry, go ahead.
Are you respite care also? Do people need that kind of support?
So we don't, I mean, we offer services to provide respite care, but it's not under a respite care window in terms of insurance and billing.
Okay,
But we are happy to help people in connecting to OIH for that respite care and helping to facilitate that a lot of times. So when we take in new clients, we do like an intake call, and that's a free of charge just to get an idea of what's going on. Often we'll give some resources right then and there. And then just sort of, we'll see if there's places where we can help as well. But if somebody calls, they need assistance and they don't have the money for private care management, then in that call, we're looking for, okay, so what resource can I give you? What information and contact numbers can I've often put people in touch with Sherry to start there to see if they can qualify for some service. We're hoping also to work with the hospital more with discharge planning to sort of help prevent the overflow that sometimes can happen by doing more preventative care with people at home.
thank you.
Thanks. Those are great questions.
Anything else that anyone wants to ask Jessica? I want to thank you very much for doing this. It's so nice to know about your services and to realize that there is a problem that we could all help solve and work on in the future. So thank you for being here.
Thank you so much.
I hope you'll come back again.
I'd love to.
Okay.
Thank you.
Thank you, Jessica.
Bye-bye.
So long.
That's a real concern here.
Pardon?
That's a real concern. We don't have that assisted living
Right.
component,
Right.
because that's what it was all set up to do. And that's where the Island Home is gonna move out there someday. Is that we have all three levels of care on Nantucket. We're missing that assisted living, and I know a lot of people are segueing out of independent into that nether world of assisted living. And they don't want to go to the Island Home, they don't have to. That's a problem. That congregate building was 90% assisted living when it was built, and was built for that purpose. And that's what it was permitted at the planning board. And that's what the special district was supposed to be. And they've gotten rid of that whole level of care. and are after the big bucks again, and that's a problem. And they're supposed to have at least 4 units of affordable housing in there for people in the assisted, the congregate building. I don't know what happened to those. They're in violation of the law and they're in violation of the permit for that. So I think these are questions we need to start asking.
Okay, good. I'm gonna move on to the next topic of discussion, which is the 2024 Elder Expo, and let you know where it stands. It was just yesterday that I sent an email to Amy Lee, who's the executive director of the hospital, telling her that we are going to separate from the hospital and do our own thing next year with Elder Expo. And I had a lot of help from Jericho in drafting this letter. I think it was extremely friendly. Anybody who would like a copy of it, we can certainly provide that. It's a public document anyway. But I also invited them to participate with us in any way they would like, because they did in the past. So I would say I have not heard anything from Amy Lee yet. I don't know if I will, but I've just decided that we're moving ahead on this. So there it goes.
Did you manage to mention in the letter, we probably should send it out to everybody. If a letter comes from this group, it should go to everybody. But did you say that it wasn't elder centric, their health fair?
Correct. I mean, I explained the fact that our mission is to serve the needs of the senior community, and it was not being adequately served. And we need to move ahead to do a better job of that.
Right.
And inviting them to participate with us as much as they want. So I think Jericho could say it was an extremely friendly letter, so.
Oh, yeah, no, and I really had far less input than you basically wrote it.
Can you send it out to everybody?
Yeah, I can send it out to everybody. I know that, the hospital will likely participate in the COA run one to some capacity, another. We'll also have, like, the health and human services will show up as well. We can make a pretty solid, outreach pitch. And then did you mention that we had been in touch with, Beth Hallett at the school about securing
Yeah, that was
location?
my next thing to mention. So also, I have been in contact with the superintendent of schools, who got back to me instantly. Oh, I love 2024 so far. Everybody is responsive.
Finally emptied out the inbox.
And I already have the form to fill out to select a date and tell them what our needs are. So I'm feeling very much that we're accepted by them and holding it where it used to be held. I have a few minor questions, like about insurance, which is required by them, but we're a town board and they're a town entity, so we'll have to figure out the details of that. But now it's a question of selecting the date. So I've done a few things looking at dates. In the past, I did some research and I see that the Elder Expo, which goes back more than a dozen years now, was held sometimes in September, sometimes in October, mostly in October, and once in November. So I decided that we should probably settle on a date in October. And then I tried to find access to the master calendar for the island Nantucket. And the best one I could find showed nothing so far in the month of October, not even the Harvest Fair. The Harvest Fair was identified as in September. So that seemed like good news. And then I looked at the 4 Saturdays in October, which are October 5, 12, 19, and 26. And I think maybe we should select one of these dates so that I can fill out the application for this school system and we can actually get on their calendar.
I think you should check the 19th. The 12th is Columbus Day weekend.
No, that's not good.
That's not good. And the 5th is too early. I go to the 19th. I think that was one of the last dates we had, actually.
Where is
So how do people feel about the 19th? Does anyone have any opposition to October 19 as the date that I asked to ask the high school for use of their?
You might want to
facility?
check with the chamber.
I was gonna say, the 2 things I would do is I would reach out, I was trying to check with culture and tourism, they have a,
Yeah, I did that
event
too, the
calendar.
cultural
I just
district.
called David right now if you want.
Well, he's not, it's Chantal now.
I just called
Oh, you can
David.
call David, that's probably not a bad idea.
Yeah.
And then, yeah, the chamber with the other one,
The
they would,
chamber is trying to put together a master calendar.
well, I know Chantal was trying to do that as well, so.
Yeah, they're working together.
Good. She used to, yeah, she used to.
Usually, yeah.
But if we tell them it's October 19th, they'll sort of tell other people trying to schedule that weekend that it's October 19th.
Okay, so for the time being, I'm gonna forge ahead to look at the 19th of October as likely, and I'll check with the chamber and with visitor services as well, and make sure that it complies with whatever their plans are. And report back to you at the next meeting.
Right?
You want to add an alternate date so that if that's taken for
That
some
might not be a
reason.
bad
we
It
It'd be
can-
the
sounds like the
following-
alternate date would be the next
The next
Saturday, which is
Saturday,
the
26th.
26th.
Yeah,
Yeah.
Okay,
From 19th to 26th of October.
correct. The 19th is the first choice, the 26th is the second choice. And that's really all I have to report so far on this. Of course, there's a lot of work to do, and we all decided at the last meeting that we want a subcommittee to look at this, so maybe that's something for our next meeting where we talk about a subcommittee who's just focused on this for the year. But by that time, we'll have a date pretty much set.
I'm in a meeting. I gotta call you back.
Anybody else have comments about this? Suggestions, criticisms?
No, I think it's great. I still have a lot of it in my computer, actually.
Pardon?
I think
I
Laura.
have a lot of it in my computer. So
Bunch
does
of her
Laura.
old,
Yeah.
like the, what they call it, and then did we, I was gonna look into, supplementary budget if we needed to pay for stuff.
And I have not talked to the Center for Elder Affairs at all about this yet. And I plan to, because I think they'll want to partner with us on this and maybe be our financial resource as well as, you know, providing volunteers and that sort of thing. I'm just expecting that.
Oh,
I've still gotta schedule another meeting, with,
John
John.
Copenhagen?
Yeah.
Yeah.
are any of those grants that you got, could those help out with?
Not
no, they're specific.
the transportation. grant.
Transportation grant would not
It would,
fit into this very
no.
easily.
There is some potential, depending on how how the state agency who is administering it, interprets this. We have some rural health equity funding, a portion of which could be made as like, not a significant amount of funding, but as like a certain amount of backstopping for if we have inescapable expenses, or if we have a couple of things that we need to, pay for as a result of this. I will have to double check my budget, my like line item budget, but we may also have some event and some like advertising and outreach money that we could put towards printing costs and such. We have not used the rural health equity funding for an event yet, but the specific guidelines on its use is anything that improves access to resources in a rural community that they do not have access to. So if we can get some flu vaccine ahead of this, that would automatically cover this for authorization of use. I don't know what the vaccination program next year is gonna look like in the fall, but there is a non-zero chance that we can schedule a concurrent flu and COVID clinic for the same day this is going.
RSV.
I don't know if the state's gonna be covering RSV yet. I know that they've been doing flu and COVID simultaneous all, like, with a mobile clinic all fall and summer, or all fall and winter. The tentative plan is for that program to restart next fall. So that would let us potentially schedule it with, a state team coming down to do mass vaccinations. Like, potentially as big as we want it. And then the other one is if that falls through, we will hopefully be readmitted to the Massachusetts vaccination program and be able to order some of our own supplies. So depending upon what's essentially my town nursing staff, we could throw a mini clinic there as well. Like, we might be able to do it ourselves if there's no mobile clinic program running next year.
Right.
And you remember the Nantucket Cottage Hospital is supposed to allocate funds locally for events and projects, et cetera, et cetera.
Well, I think
As
that-
part of their 450 grand that they're supposed to be spending down there.
Well, I think that's part of what they call it the Health Expo? That's part of their expenditures under that amount, but I'm not entirely certain.
So we should just have that conversation if Amy at that moment gets back to you. about any funding available on their local initiative, which
They-
they're supposed to do
They would-
every year.
I would be surprised if that funding can be dispersed like that from the hospital. In
Well,
the
something to
past-
ask.
It's something to ask, but in the past, like with the CHIPS funding that they distributed
Yeah.
out, that was all through a third party grant allocating, CFN in this case. So I don't know if they'll directly grant money out to. I'm certain they will not directly grant money out to a town body. The only agency I know that could receive money from them in this context would be
NCEA,
NCEA. Yeah.
that's what I'm saying. There might be a mechanism.
I think that would be the best bet on that, but ballpark, what are we thinking for a budget on this?
Well, I looked at the past budgets and they were very small. I mean, I think between $2,000 and $3,000 total. So, but we didn't get any expensive speakers for sure, and I don't know if we'll want that.
So-
I'd like to bring up this topic at NCEA's meeting this month. I always attend their meetings, as does Robert. And I just like to give them the lay of the land on what we've been talking about and what the situation is, and invite them to be a co-sponsor with us and see what the reaction is, which I'm expecting will be very positive.
Good. That works.
So what does, I'm new to this, so what, does this event look like? I'm imagining a lot of tables that there might be vaccinations or information on.
There are a lot of tables,
Medical
actually, the
things.
best person to describe this is probably Laura. I'm gonna proceed though, because I don't see your face, Laura. There were about 30 tables with.
Half of which are from off.
Represented, yes, Cape Cod associations as well as Nantucket.
Fire department.
Anyone who provided services to seniors, including the banks. The library was there because they deliver books to seniors. So anybody who had any services that would benefit seniors had a table.
Mhm.
And
Most
then
of
we
them
had
had little
speakers.
things
We've had as many
to
as
give
3 speakers going at
Swag.
different times, one at 10 o'clock, 11 o'clock, 12 o'clock.
Mm.
We had a cooking demonstration by a chef who taught seniors how to make simple meals and then provided samples right there. We had free coffee and donuts for
Yeah.
everybody, and vaccinations. And in that case, it was the Visiting Nurses Association from Off Island who came over
Yeah.
and brought the vaccine,
The BNA,
and they did a great job.
yeah.
We had the funeral guys were here. I mean, we covered all of
Looking
the
ahead.
needs of the elderly, and we had a lot of people came through.
And
there.
how does it get advertised so that people know this event? Like, how are they gonna know October
Use
19th?
every available
Yeah.
medium.
Laura has 500 some odd
Online,
people on her
electronic.
mailing list,
Mhm.
her newsletter. I can probably get pro bonos from the current,
The INF,
INF.
posters.
They'll both,
all over the internet.
they'll likely both want to potentially cover this as a story. I think they did a story on the Health Expo this year. One of the two of them did, I can't remember.
Yeah.
Yeah.
And then we'll have town social media, the town manager's newsletter.
Laura's newsletter.
Laura's newsletter, there's the, I could likely take out, depending upon how long we want to run it.
We had
we could do
posters that I put up.
Posters and flyers, and then we can also do, we probably have, like, if we're looking at a total budget of like 5,000 to 6,000 with inflation, then I can probably handle a short, print ad during the same time.
So it's out there. And
Yeah,
people know.
Good. And what age group does it target? Does it start at like
Well,
60 or?
We're serving the 60 and over community, but the whole community is involved
Mhm.
and invited to come in. So you can bring your grandchildren or your children or, because it's a family thing. They
Right.
all want to support their elderly
Right.
relatives.
Family members came that were, caring for an elderly person or had concerns about an elderly person. We now have other services here. The last time we did one, we didn't have like that service. Like, the Alzheimer's group, we have stuff that wasn't here the last time, so now we have stuff here to even promote locally,
Mhm.
as well as the agencies on the Cape that can help locally, and Sherry's there, I mean, everybody's there.
I think the, community fund also just has been doing some elder focused. Were you on those
Yes,
meetings?
but I
Is that-
think there's nothing substantive as a result of that, although it's always worth going back to Sunny Daily and seeing now that we have this thing, it's a real event. maybe there is some interest in
They would
sponsoring
make
that.
a pretty interesting partner on that. They cover some of the outreach spots we don't have, and they have access to an even wider array of nonprofits than I think. Like, there's some nonprofits that they have access to that aren't in our normal circles that might be interesting.
Yeah,
Especially if they're making an expand, like if they're trying to push into senior focused care or senior focused grant writing. And then,
They can always provide funds as well.
that's all.
Community foundations always provide.
would you be
backup
willing
funds.
to talk to her about that?
Yeah,
Before
yeah.
next meeting?
Yeah, I can do that.
Just so she's aware of it and is thinking about ways they may participate.
Ironically, I was just over there for a meeting. Yes, let me talk to my phone outside of line of sight because it's embarrassing. to Chloe, if I remember.
The topic of the Elder Expo is undoubtedly going to be on every single meeting agenda from now until October, so you can expect more of this next time, and we'll come up with a subgroup to work on it specifically. But I want to move on to the next thing on the agenda, which is Robert talking about the Historical Association.
Okay, the core program of NHA on the road, in December, we hosted visits to the Festival of Trees with 4 of the senior centers, the Salt Marsh, Homestead, Landmark, and Sherburne. Unfortunately, because of the COVID outbreak at our island home, they could not come.
Oh,
As far as January, we're going in
It's over
with
now.
the presentations in January with the artifacts will all be on the old jail.
Cool.
As far as the spin-off program, NHA on the road overseas, we are talking to 6 senior centers on the Cape, and we'll be moving hopefully February through April into the senior centers on the Cape, offering programming from here. Live programming.
Wow.
The initial program will be the Life Aboard a Whale Ship, which is the signature program at NHA.
I love those videos.
As far as a new program, though, as a spin-off of our Mindful History, in February, they are launching what is called Mindful Memories, which is going to be a program for caregivers and people that are starting to have cognitive dementia. It's going to be a very interactive type thing. You'll be hearing more about that whole thing as we launch into there.
Cool.
You want me to move to Elder Services?
Yes, please.
Well, but while you stay on the museum though, isn't the museum closed to the public here for a little bit? Didn't I see
Yeah,
that
so
come
February
through?
14th,
That's what I thought.
because we're putting in new exhibits and everything else.
Okay.
is
After they
that
take the
open
tree
to the
down.
public now? Somebody told me.
It is open to all permanent residents.
Oh, okay.
All you have to do is show us a driver's license to say you live here.
Yeah.
You can't show us an electricity bill or one of those. You have to be a real resident because the grant stipulates it is only for permanent residents.
And I have to take our tree down on Thursday, isn't that correct?
That's right. There's a schedule. I don't get involved in the free.
Keep forgetting, I gotta go back in there and take it apart.
Yeah.
And before you move on, people who are on Zoom, do you have any questions or comments for Robert on the Historical Association?
No, thank you.
I didn't hear that.
I was,
He said no.
Rocky said, no, thank you.
No, thank you.
All right, thank you. Go ahead.
As far as Elder Services, the big event they have coming up is called the Aging and Disability Resources Consortium Legislative Breakfast, which is being held on the Cape on February 9th from 9:30 to 11:30. All people that are interested can sign up to do this. I'll leave this with you, Jericho, as far as how people would make a reservation to go to breakfast. There is no charge for it. It is being co-sponsored by the Cape Organization for Rights of the Disabled and Elder Services of Cape Cod and the Islands. And they've got a long list of about 20 or 25 legislators that have all been invited to come to breakfast.
Interesting.
So that pretty much is what they're up to right now, what we're up to right now, getting ready for.
Cool.
Any comments or questions from the Zoom folks?
Sounds,
Okay. Thank you.
I think we lost,
Thank you, Robert.
Jude.
We do appear to have lost you.
Jericho, you're up next?
Yep, I will do a brief report on human services since it's a lot of stuff that's in the weeds. That is primarily of interest to myself or maybe Linda because it's CRC related. We finished up the youth behavioral health grants. The current contract review committee and substance misuse grant cycle will start deliberations next week. Of note is, I believe, Elder Services of Cape Cod and the Islands has applied for a grant through the town again to supplement the congregate lunch program at the Salt Marsh. They did have to increase their ask this year as transportation, food costs, and cost of living adjustments have led to a shortfall of funding.
Some of the vendors are wanting 20 to 40% increases.
When I've seen both labor costs, transportation, fuel costs essentially, and then also anything to do with food, like food and staffing, go up between 15 and 20.
And it's all over the Cape, it's all over the
Yeah, and
state.
John Keene's having trouble getting the staff.
Yeah, they had to, and then I believe they cycled through their staff at Elder Services. The congregate lunch staff has been, I think, who was the gentleman who's doing it forever? Just retired,
Caroline.
Caroline.
Ferguson, Caroline
Ferguson is still handling it right now.
She's doing it now. And who was the gentleman who just stopped?
Mark Boudet.
Mark, that's right.
Oh, Mark stopped?
Yeah, he just
Yeah,
like,
he had to
2 months ago?
retire because of health issues.
I love Mark.
That's
But
great.
he's looking wonderful. He came in one day last week. He looks fabulous.
Grab a
So I
bite.
thought, oh, retirement is good for him.
past that, in terms of elder facing, hasn't been a ton of stuff over the course since last month. It's mostly been end of year stuff, prepping for quarterly reports, and then getting, a bunch of, things through finance. Speaking of which, signature on should I jump ahead?
Go ahead.
We're technically skipping ahead to report on recently received transportation grant, which is that it will be going through and receiving a signature on the 10th, which will give us a full 48 hours to get it to the to the grant.
Thank
the
God
grant
for
court.
email.
Yeah, no, I think digital, and then we can overnight it too if necessary. And that is a grant that Marianne will go into more depth in item 7. Past that, we have one more confirmed COVID clinic on the 20th of this month. It will also have flu, so if you have anyone who needs a flu shot or needs a COVID shot, i.e. anyone who's gone longer than 6 months without a COVID infection or without a shot, should sign up. We'll have that webpage with the sign up link up as soon as the state gets it to us. There is a possibility of a February clinic, but it is not confirmed, and I'm not sure if the program will be continuing through to February. But that should be the last vaccine I am aware of. There does not appear to be anything going on at the hospital for COVID vaccines right now. Dan's is not doing them. We cannot order directly, and then we have the state mobile vaccination teams coming down on the 20th of January. And then potentially again in mid-February, so we get the last batch of people before they go away on February vacation.
We have to wait 6 months from my September one.
So if you got one in September, did you get it at the school, the elementary
I
school?
go to dance.
You go to Dan's. So if you got it at Dan's in September, you should have gotten the updated dose, and that should get.
It was delayed, it was. You
Then-
just got it in. I got it the next day.
Then that should get you through this winter season.
Okay.
If you have not, right now, we had a report from a Martha's Vineyard-based epidemiologist who's been doing quite a bit of modeling and analysis for us. And we are in one of the higher rates of infection and rates of hospitalization zones in Massachusetts for both flu and COVID right now. We're relatively high, but we are I don't think we've had more than 1 or 2 COVID-related respiratory disease hospitalizations at once in the last 2 to 3 weeks. So we're not at anywhere near the worst situation, like in terms of hospitalizations that we've been in during the continuing on.
Well, there's not a lot of people who have it. They
Yeah,
got it
well,
before Christmas,
it's,
and a lot of them are coming back from
It's
vacation
the
with
s-
it.
it's this.
I got a whole household over
The
there, not
travel.
mine, that
It's
had
the
them.
travel, it was rising last week.
Yeah.
It's been rising week on week for 2 weeks, and
Yeah.
you should expect the highest spike from this to
This
be
week.
this week and
Yeah.
early next.
Yeah. Don't go out.
Don't go out. If you do spend more than 15 minutes in public airspace enclosed, you should consider wearing a mask and N95, especially if you're at risk. This is probably historically this period, the immediately after the holidays, and then the largest spike traditionally has been after
February
February
vacation.
Sure.
So those are the two ones. If you can get through that, you should be through to this season, and hopefully we'll have a nice big vaccination program going next fall.
I didn't hear a lot that came out of December to light, which was very unusual.
Yeah, I don't know what happened. There was a minor wastewater spike, but not consistent or large enough to have a causal relationship. We did
Yeah.
have a big spike after the special town meeting, a relatively big spike after town meeting. But I think we're gonna probably peak in 2 weeks and then peak again at a slightly higher level, like a week to a week and a half after February break. Traditionally, I say traditionally, but for the last 3 years, that's been the biggest, the highest transmission rates.
That boat is a problem. A lot of people got it from that boat traveling over Christmas.
Oh, yeah.
Yeah.
So that's basically my major updates. As always, if anyone has something they want to figure out about why the town is doing something some way, or if they have any other questions for me, you can ask me now. If you think of them at a later date, you can email or call. Email is usually quicker. But any questions from anyone? Nope. Sweet. All right, next.
Thank you. Laura, you're up.
Hi, everybody.
Hi.
Hi.
How you doing?
I could be better.
Does she have COVID?
Not COVID, but she,
Bronchitis.
Ay, ay, ay.
Yeah. So anyway, we're not talking about that. I'd show you my picture, but you don't want to see me. So things have been going really well at the Salt Marsh. We've been very busy, and we're going to be really busy this winter with just lots of things from NHA and the Life Saving Museum coming into the Salt Marsh and having seniors go to their museums. It's really fabulous that they're doing all of this, especially this time of year when, you know, there's reasons to get people out of the house more often, even though the weather is chilly. We have started, we've always had like a bridge instruction group, but one of our members came up and wanted to start a Mahjong instruction group so they could kind of boost their playing people. And it's really gone off quite well. They have like 8 to 10 people that are learning Mahjong. So that's really cool when you know, members of the Salt Marsh come to me and say, can we do this? And I say, if I can find time in the schedule, of course. Another thing that we just started is a knitting group that somebody else, another member wanted to have. There is one at the Athenaeum, but it's late at night and people, you know, this time of year don't want to go out. So we just started that yesterday. I was not there to know how many people arrived, but we're just going to keep on doing that and hope people show up. Another thing that's coming up that's really exciting that Caroline Ferguson from Elder Services kind of got started was she's in touch with a gentleman who works with the children's comedy shows, and he would like to come to the Salt Marsh and kind of help seniors go through a skit of their own that would be comic and then have a show at the end. So
Are you
he's,
talking about Kevin or somebody else not involved with us at the comedy?
no, it's Kevin, well, it's not the gentleman, I forget his name. He is from not Health Imperatives. What's the other one? You know, that
Family Resource Center?
maybe he's from there. I don't remember. Anyway, I don't have all my information with me. Anyway, he's great. He's working with the kids at the Boys and Girls Club to do that like stand-up comic thing and
That's
hopefully-
Kevin Flynn.
Yeah, he works with Kevin Flynn, but this is at the Boys and Girls Club. Usually Kevin, I think, does one in the summertime for the
Well, he
kids.
does them all winter, but,
It's not Kevin
it's
Flynn.
not Kevin Flynn, because I help run the comedy festival.
So anyway, he's working with the kids at the Boys and Girls Club, and hopefully they will come to this Salt Marsh to do their little skits. So our seniors can come and kind of see what they would be working on, and obviously it would be funny to have. So anyway,
It could be hilarious.
it could be.
That's
So
what they're.
spread the
Yeah.
word. We need some seniors
It's not
to do
Brian.
this.
We
It
could all
sounds
make
really
our
cool.
families.
It's not Brian.
That's Brian Glowacki, right?
No,
Okay.
All
no,
right.
no.
Somebody I've worked with, but I just can't I can't place it.
So that's exciting. And just to throw something out there, Jericho comes to do a tech clinic at the Salt Marsh once a month. But we
I'm
need,
doing it.
we need
I know.
somebody who will
Let's go
come
fast.
and who can be there, volunteer more often. So if anybody
Sorry,
knows,
Laura, could you repeat that last sentence? People were talking over you and I couldn't hear you.
oh, sure. So Jericho comes to do a tech clinic once a month at the senior center, but we really need somebody to come once a week for, an hour or so. And a volunteer would be perfect. So if anybody knows anybody that's available during the day, in the afternoon or the morning, actually, but it's a tough thing. We've tried to get the high school kids to come, but they're busy with everything. So I'm just throwing that out there. If anybody has a brilliant idea, pass it on to me, please.
And Laura, I have not yet reached out to Athenaeum about adding that. I think whatever they would do would be more large scale educational. It's gonna be kind of tough to get someone in there to do individual, like solving text.
Yeah, you mentioned that. Nobody wants to do that. anyway.
Any questions for Laura?
I have a kind of a question, apropos of what you said. You said there would be a spike after Christmas. And I was wondering if the Salt Marsh, I'm gonna be going over there, and I was thinking, when are those spikes? Because it might be nice to have masks at the front desk there, so encourage people so we don't get an outbreak
So
at the Salt Marsh.
Laura and I have talked about this. I think the last time we talked about it was November or so. But there are situations and rising metrics that will make me mandate mask use in there, no questions asked. So basically, if there are 3 straight weeks of rising positivity rates in the wastewater,
Mhm.
or if there is a confirmed case or exposure through the Salt Marsh, then we go to masks. In the past, the masking has been once the masking gets up, it's at least a week. Most likely what'll happen is if we cross that threshold, then what we'll do is it'll be masks for a week. And if the indicators have died down, like if the wastewater results have gone back down, we'll relax the mask mandate. It's not. There is a utility in having masking there because of the specific population that visits, but if you only mask in one location, it's meaningless. So I would be doing that to try and limit transmission. If we cross a risk threshold, there'll always be masks there available. And Laura, if you're out of masks, well, I'll check with Ginny about it tomorrow, but I'll make sure there's more masks, more surgicals down there if you need them. Okay, and then, I'll just have them put signs up and be mask mandated. I've done it a couple of times. I think I was the last location on Nantucket twice, that had a mask mandate.
Yeah,
Yeah.
and it's not just the
22.
COVID, it's sometimes this RSV or some of these other viruses that we don't even know yet. If they spike just after Christmas when people are coming back, it's not a
So-
bad idea to have them available for
So
people.
first disclaimer, not an epidemiologist, but the epidemiologist that I have read suggests that there is likely a pretty solid co-infection of RSV, flu, and COVID. So that if there's a spike in wastewater, COVID
Oh,
wastewater,
okay.
it would be representative.
The same,
It would
okay.
at least be like if COVID is rising, everything else is rising too. And then Erin, our public health nurse, has access to Maven, which is the epidemiological database for Massachusetts. She's in contact with an epidemiologist off island, and she's getting every confirmed case of all of these. And as soon as those go past the threshold, or if there's any pattern through contract tracing, same thing, masking will go right up.
Okay, fun times.
And we've likely got another year and a half of this before the virus stabilizes into just a more lethal form of flu. But it's gonna be another one of these next fall too. It won't be as bad. It'll just, the pendulum will swing and center down a little bit, and then we'll hit equilibrium like we were with flu beforehand.
I know Mass General just instituted their mask mandate back again. We can't get into the hospital without.
Did they put that here at NCH as well?
I haven't seen it here, but being that we're so closely aligned with Mass General, I can imagine that's coming back here, but I know it was like the last 48 hours they did it in Boston.
They're wearing masks at the hospital. I was there this morning.
Okay.
Mandated
Then
on
it did come
entry?
down.
I think they're heavily encouraged.
Okay.
Heavily
Yeah.
encouraged, yep.
Most likely what I will do is I will start mandating masks. I think the next sample gets taken. There was a gap in the sample taken for the holidays. The next sample, if that continues to trend up, I'll just mandate masks.
Yay,
Yeah,
I'd rather be safe than sorry.
I just pulled all mine out and put them
I got
where I
my,
could get mine.
anyway, sorry.
Laura, on a happier note than COVID, you weren't there today, but I think it's worth mentioning that NCEA is upgrading the video equipment in the salt marsh. They're getting as big a TV screen as they can possibly get. And really good audio, including special help for people who have need hearing assistance.
Oh,
So the guy was in there today, learning all about what's needed. So I think that's a step in the right direction. Yeah, and then, of course, the video equipment will be used for Monday movies, which are really popular, but also for everything else that now involves using a screen. So it should be a significant upgrade.
Excellent.
I will not be renting it out for movie nights.
well, you got
They
closed
already have
caption.
their own-
Not gonna use closed caption.
I don't-
for everything.
Thank you, Laura.
Welcome.
Okay, we'll end this on the very last topic, which is our transportation grant and where that stands. Jericho mentioned, we need Libby's signature on the contract. She has a deadline that's been imposed of the 12th, so she's gonna make it on the 10th. That's good. And then we'll start proceeding. We don't have all our ducks in a row yet, but I'm participating this Friday in a Zoom call with transportation managers in other towns around Nantucket to talk about their relationships with Uber and Lyft and how to do a better job with that. And I'm hoping that I'm gonna get some really aha moments from that. And that we'll be able to apply it to our own transportation grant.
Now, explain it to me one more time.
It's a reimbursement grant for seniors who use taxis or rideshare programs.
Yeah, or
Basically,
even to the hospital in Boston, if you need to go to the hospital and take
So
any
they'll-
kind of
big a
expensive
grant is it?
transportation.
How
7,000?
was it?
7,700.
So they pay for it and then they submit for reimbursement.
They pay for it,
Somebody
they
pays.
submit, I think that at point of service, the plan was for it to be the senior, correct?
Correct.
And
And
then,
NCEA will reimburse the senior and the town will reimburse NCEA.
which will fix the gap in how long it took for us to get reimbursements out and a couple of these other grants we had.
I just, politically, I think including Uber and Lyft is a mistake.
I think if
I
they're,
think the cabs are where they should
Well,
go.
I'm trying to make the seniors happy. The
Yeah.
idea is to satisfy the seniors' needs. Our taxis, great. But if a senior has an Uber account and wants to use Uber to do whatever they need to
it
do.
would just be they
I'd
would
like to do
show the credit card receipt, or the receipt. or
I
the
got it,
credit
but if
card.
the town
But it's
basically paying Uber and Lyft, and that is still a very sore subject for all that.
yeah.
Not for the
200 cab
senior who's
drivers.
using it.
It's,
I got it, I got it.
I
do
have a
too.
question about the
Maybe-
transportation grant when you're ready.
Yeah,
Sure, Arlene, go ahead.
Okay, I have a dear friend whose mother was released from the hospital recently, and she is not capable of walking. She has home health care, but when she has to go to the hospital, our local hospital, there is apparently no van that can take wheelchairs on.
Wow,
the
that's not
island,
true.
which I had no idea.
that's not true.
When
So
my
there are-
grandmother was
there are at
around,
least-
we
There are
had a
at
van,
least
right?
two
So-
cabs, if not three,
there's one,
that has to operate year round.
there's one NERDA operated Our Island ride, which you have to call 24 hours ahead, and it costs $1 each way, not just because that's the nature of the beast. There
Okay.
are at least one, I'm not sure who the
Not
second
two,
one is.
there were
Who's the second
two.
one? I know, because A1 still, not A1, Rogers still has a handicap
Okay.
access one. And there was one that I saw in the summer, but I haven't seen it running. It might just, I'm not out a lot, so maybe I'm not seeing it.
And
But
they,
there's at least one taxi company that.
and they have to operate year round.
You hear about the accident,
Oh, is that who was in the accident, Roger?
the Roger, yeah, so.
Oh, that was a bad accident. Roger went to the hospital or whoever
Well,
the
the
driver was.
taxi,
Where was it?
Yeah, that's
Old
true.
South Road and
New Year's
Fairgrounds.
Eve.
Oh, New Year's Eve?
Yeah.
And Surfside,
Wow.
that intersection,
Yeah,
I don't know, I just read about it.
I don't think there's probably that van, but there's a requirement for whoever's got the handicap van. Erica at the select board's office has that list of who's supposed to be operating and who hasn't.
So Arlene, is that helpful to you?
Yes, all I was aware that NERDA did have something that you could call 24 hours in advance, but apparently there's a list somewhere. Linda, is that what you said?
There's a list of cab drivers with handicap accessible cabs, number one. Number two, the Island Ride, I know operates at night because it comes to get Diane Coombs from the HDC meetings at 8:30. So that's all set up.
Is it
Every single
long?
Tuesday, you have to set it up, but they will do it at night. They will do it in the morning. They'll do it whenever you need it.
It's just as long as you notify, if you call through NERDA 24 hours in advance of when
And you set it
need
up.
time, and then that should work. Eventually, once this grant is up and running, those seniors could simply take a taxi or take a cab. Then they would submit the receipt to this for reimbursement through NCEA, and then we would pay NCEA back out of the grant funds released to us by it's an MCOA board, the MCOA grant?
MCO,
Massachusetts
Council
Council
on
on
Aging.
Aging.
Here's a logistical question. Is she permanently in a wheelchair or can she use a walker?
Are you talking to me?
Yeah.
I don't know the details of that.
The only reason I'm asking, I was on the Commission on Disability for 28 years. The only reason I'm asking is that if she's ambulatory to some extent, you can get something called a slide board.
Oh, yeah.
She can get up to a regular cab and use a slide board, which goes from the wheelchair or from the walker straight into the cab and then out again into the, whatever she's using to get around in. So there are a couple of different ways of dealing with it. If you couldn't get a handicap van, you can use a slide board, which a lot of my handicap friends have their own slide boards.
Okay. All good information that I'm writing down.
You can always call me and I'll give you more.
We've come to the end of our agenda, but I want to ask a question of people. I'm thinking of inviting to our next meeting as a speaker, Brenda McDonough, who is the Commission on Disability, and Mickey Rowland, who chairs that commission. And if there's enough interest here, I will invite them. Is there anybody who would say no to that?
No, I've worked with them both. I was on the commission with them.
Okay, so I will invite them as speakers next time. Before we close, if anybody has any other comments or questions, now's the time.
The only other comment I have is I noticed that we have one seat available on the Council on Aging. Are we looking to fill that?
Always.
Okay, so,
They probably won't advertise for it now because it's January until May. So they do the appointments starting in July 1.
What's the two sessions? It's, so the recruiting is May for seating in
There are two
and
two
June.
deadlines,
And
but
then
they,
the ones
this year they
fall.
made it all one deadline.
Okay.
So just, it has to be looked at, in the paper. They put it out in the paper.
But it's never, it's always a good time to talk to people that you know
Yeah.
who might have any interest and get them thinking about applying for it.
Absolutely.
Anything else on anyone's mind? That has to do with the Council on Aging?
Thank you for that.
I'll make a motion to adjourn.
I'll second.
Okay, Linda and Robert, for the minutes. And, let me go down the list,
Oh,
if I
yeah.
can find my list. Okay, if you want to adjourn, say yes. Abby,
Yes.
Rocky,
Yes.
Robert,
Yes.
Arlene,
Yes.
Jude,
Not here.
Linda,
Yes.
Mary Ann, yes. Thank you, everybody. See you next month.
Happy New Year.
Happy New
Yeah.
Year, everyone.
Thank you. Happy New Year.